Okay, so we can just start by giving your name. You can feel, you don't have to look right at the camera, you can look at me.
Okay, good.
So go ahead and tell me your name,
Okay.
where you're from.
My name is Linda, and I'm from Hudson, New York. I hurt my back in August of 2006, and I couldn't do any, I was crawling on my hands and knees for at least 5 days, if not 10 days. I would, to go to the doctors, my friends would come and, help me, that type of thing. It was total agony. I went for physical therapy. I went to Albany Medical to make sure I didn't need surgery, and the surgeon ruled surgery out unless it was totally necessary. I went for physical therapy for quite a while, and they told me that they were through with me, but it would end up being 3 to 5 years before I would be totally corrected, this type of thing, that it would take a long time.
Wow.
My late husband was a science teacher, so I talked to an office mate of his who told me the same thing, because it takes so long for the nerves to rebuild. They don't repair, they rebuild. So I was figuring on waiting 3 to 5 years, walking at the pace of a snail. It took me like an hour and a half to go grocery shopping and get 20 items, this type of thing.
But what did they tell you was wrong?
They didn't really say. I was led to believe I'd herniated a disc, that type of thing. They didn't, and he got out a small model of a disc and showed me that I had herniated it, and that type of thing. But that was about all that they gave me.
And the pain was in primarily your lower back?
The pain was in my lower back. My right leg was totally numb from my tips of my toes all the way up to almost my waist.
Wow.
And I could, feel the numbness. Gradually it went down, so that at this point now, just my foot has some numbness to it. But that's it. It took a long time for that to go down. It took a long time for me to be able to lift my right foot up off the floor, as your messages go through your nerves to do things like that. So my right foot was like a club foot, and I'd walk with a whomp.
Wow.
And things like that.
And what brought you to Dr. Milham's office?
My boyfriend heard Dr. Milham on the radio. And I kicked myself because I didn't come when Jack first said to me, you should try this guy. And he said it 3 times, and I said, well, they told me 3 to 5 years, so finally he pushed me into my call, the free consultation with Dana, and I talked to Dana, and I came up here, and after the first initial treatment, we went out to eat that night, and I stood up at the restaurant, and I was totally in shock. I had no pain or discomfort whatsoever in my back. I hadn't felt like that since I don't know when.
That's great.
And it was just so wonderful. Only lasted for about 20 minutes, but still, one treatment got me that, and I was totally hooked at that point.
Great. So you finished the treatment
So I
program.
finished the treatment program, and now I'm on maintenance and loving it. The other night I went and did a bunch of errands, and I was home, and 45 minutes later I said, well, I did all this.
That's great.
And I can move faster and things like that. It's nice.
And what was your experience through the treatment program? How did you feel?
Each treatment I felt better. The treatments weren't really painful. A little discomfort occasionally on the traction thing. But once again, the discomfort would last for maybe 5 minutes, 10 minutes, and then be over with. And rather than walking out of here most days, I floated out, because I just felt so much better than I did when I came in.
That's great. You're feeling great now. You're
I'm
in a
feeling very
maintenance
good now,
program.
yes.
So primarily, what are you working on now in your maintenance program?
Primarily now it's just doing exercises and lifting weight, doing weight exercises, that type of thing. Having Dr. Milham check me for the balances and things like that. And that, just
trying to keep your
body keep my body the way it should be, so that and take good care of my back, because that was my problem. I didn't take good care of it before. I didn't realize that it had to be how much was involved in taking care of it. So I definitely am taking care of it now.
Well,
I don't wish that pain on anybody.
Sure. I know, it can be bad.
Yeah.
Well, I'm glad you're doing so well.
Thank you.
Thank you for sharing your story.
You're very welcome. I wish I had known about Dr. Milham 2 years earlier. I really did, because I said to myself, all that pain since August 2006. That's almost 3 years.
Yeah.
And if I'd known Dr. Milham earlier, I would have been less pain.
Well, but here you are.
But
so.
I'm fixed now, so it's good.
Great
And
job.
I do all I can to tell people about it.
That's terrific. Terrific. I'm going to turn this off. That was a great job.
Thank you.